When I started the practice in 2008, one of the things that attracted me to the practice was obviously working with Paul. We're of a similar age, and we're both pretty dynamic in our drive to understand and progress in dentistry, and understand that technology is evolving all the time, and we need to stay on top of that. Hence why we invested in a laser a few years ago. We've invested in a CT scanner last year, and there'll be other things on the horizon. And yeah, some of them are toys, and we love our toys, boys and toys, but that we only go for the ones that are actually going to benefit the patient at the end of the day. The majority of patients we get are associated with complex dentistry, mainly because that's the style of dentistry that we do, and we're able to deliver more complex, more advanced processes. Along with that is the implant side of things, where obviously a lot of my patients are let's say in the older category, and after a bit of wear and tear and a fruitful life, you tend to have things that break and lose teeth, and those are the cases and the patients that I tend to look after. The technology is advanced to a stage now where people don't just have to have a denture. You don't have to tolerate having a denture. We look at every aspect of your mouth and talk to you, sit you down, have a conversation. What do you want? Do you want something flopping around in your mouth, or would you like something fixed? I suppose my special interest really is what we describe as occlusion. Occlusion is about force, and the more teeth you have to spread force across, the more likely you are to keep your teeth. And obviously when you have missing teeth, you've got to put teeth back in, so that built in the implant side of it. Cosmetics comes into it because, lo and behold, teeth that function properly actually look pretty nice as well. And so I personally focus on how you bite and how you distribute that force. And by setting those teeth up in the right parameters, the right frame, then the patients get a beautiful smile at the end of it. I come up with various different treatment plans for clients when they see me, and I literally say to them, if you were a family member, this is what I would do. The thing I love about dentistry is a patient saying to me they haven't thought about their teeth. I say it all the time. It's the most important thing to me, because it tells me that patient has come in with a problem. We've treated them over a period of time. They've left us. They've got on with their life. They come back for their review, and I ask them, how you've been, and they tell me about their holiday. They tell me about their new car. They tell me about the problems they're having with their house, and then I say, the teeth? And they say, I haven't thought about those. And that to me is, I've done my job.